today I'm going to be going over some instructions on how to use a Hoyer lift properly and safely with my awesome demonstration partner here, Mr. Taylor. So first thing we're going to want to do, if the patient is in the bed and you're having to get the sling underneath them and you do not have experience getting the sling underneath them, first thing you're going to want to do is orient yourself with the sling. This one's meant to be able to use a commode, so we're going to want the commode part towards the foot. This next part is going to be getting the actual Hoyer lift to the bed, underneath the bed, and set up to pick up the patient correctly. This part can be fairly important. As you're moving like this, it is okay if it is in the current position. When you go to pick up a patient or when you go underneath the bed, it is essential that you spread the legs so that you have full stability. That is very important, and you will also have to lock both wheels. They lock as a hospital bed would lock, or most locking wheels on overbed tables. If you're familiar with any of the equipment, it's a slight push down on either side to lock those wheels. You can push them back up. It might give you a little bit of trouble. And now you're unlocked again. Now we have raised the bed all the way to the top. This part is important so we can easily get the patient into the Hoyer and the Hoyer over the patient without there being any discomfort. If this bed were to be on the lowest setting, not only would we be forced to use the longest strap, there would be a much higher chance of pulling and snagging and pinch points on this patient before we even had a chance to raise the lift. So that's another very important thing you're going to want to note when you're going to set these up and move patients. What I'm doing now currently is a hand pump. Some of them are electric, some of them are manual. The one we are demonstrating today is a manual. What I'm doing right now is just pumping it up. This will allow it to lift through this mechanism right here. I'll turn this so you can see on the other side. This knob will help you release tension so this can drop. Now it's important that you do not just willy-nilly super turn this knob. It could potentially be dangerous and it could jerk the patient. We do not want the patient to be jerked in midair. So we will, as slow as we can, slowly start to move it till we find that sweet spot. You might even need to feather it or just slightly going back and forth so you can find that spot where it's a nice, slow fall. It's nothing fast. You're not going to get anybody hurt. This is really ideal. And then when you're done, all the way to the right, tighten it back up. Start hooking up all of our connections. Ideally, you're going to want the patient not to have to move too much while you're doing this. If there's a little bit of movement, that's okay. You're going to be wanting checking for pinch points and any weight-bearing points that are touching the skin or the patient anywhere as you're doing it. So throughout the whole process, it's not necessarily a bad idea for you to be checking the weight-bearing points as you're going through it. You don't want any skin pinches or anything like that. That is one of the main things we would want to avoid, actually. So we'll just get our connections. For this guy here, we are using our longest strap. You obviously can use the shorter ones. If it's a smaller person, they're probably not going to need as much space. But since this is a bigger person, I went to go with the larger straps. It's also a little bit of a more durable person, so I don't have to worry as much about them being jostled around in this situation. We already have the legs in an elevated position like this. We can slowly start to lift it. This part is for demonstration's sake. Typically, your DME technician driver is not going to be hands-on with the patient like this, so please keep that in mind. So you're going to go ahead and call help in here from my lovely associate and have him on the other side of the bed just for a moment here. So as I'm lifting, if you wouldn't mind, check for pinch points on any weight-bearing spots. Make sure our patient is nice and in here. And if you wouldn't mind supporting the head and neck just slightly as we're going up until he gets in that seated position. All right, now this is a perfect example because our patient here clearly is too tall for our Hoyer lift to have him properly adjusted off the bed. In order for them to be adjusted off the bed, their butt should just be right off the bed, right above it. In a situation like this, which is not typical, you can slightly lower the bed. You're always going to want to keep a hand either somewhere on the patient or the lift. Like I said, right now there's 2 of us, so there's 2 hands on it. But when you can keep that one hand on there, because if you were to accidentally lift the patient too high or you drop the bed too low, you do not want the patient to begin swinging. That is not something we would like. It's not fun for most people who have to be using these types of things. Mostly can just make them sick, and that's not a good time for anybody. So we will slightly lower the bed as soon as the butt's off the ground.
Not yet.
All right. So the butt is now slightly off the ground or off the bed. That is how you know the patient is up high enough where you can slowly start moving them. All right, so now that we are in position over the wheelchair, we want to make sure both wheels are locked before we do this. Our stance is wide. That way we have as much stability as possible. Some patient lifts are not going to look like this. They're going to have a separate lever over here that's going to allow you to change the width of these wheels, which means not all of them are going to have a 2 setting all the way wide and all the way closed. Always make sure you're on that widest sturdy setting when you do that, because not all of them have the foot changer. Some of them do have alternating settings for those, and we can go over that later and why that potentially could be useful. But for now, since we're locked and we're in position, we are close enough in the wheelchair, we're going to slowly start to let our patient down. This patient's a little bit healthier. We're still going to need to be careful, though, that we don't want any type of rushed movement, no pinch points, and no hard jerking around while the patient is being lowered. So we're going to come over here to our dial, which I had explained about earlier, and very, very slightly and easily, if we can, start to let out that pressure. Keep him where he needs to be. As you can see, I'm not touching it anymore. It's slowly letting him down. The wheels are locked, and it can keep going. Now that the patient is in position and seated, we can start to let this down a little bit more, and then we're going to stop it. There's a reason I stopped it here. As you can see, there's still a little bit of tension here. There's still a little bit of tension here. This thing will move. Not all these are set up the same. Some of these are not coming with these attached, and there'll be a separate piece that comes with it. In our scenario here, we have an awesome one which is already attached. But the reason for doing it like this and not letting it go down further is because, for one, this will just keep going down and bunk our patient in the head, and we do not want that. So what we're going to do here is try to levy it in a way where we can get one part off first. Notice how I'm not taking my hand, and neither is my associate, off this swinging metal arm, because otherwise it could not be great. If you wouldn't mind taking off the gray part. Now when this happens, sometimes in certain scenarios, because the legs are still pinched, that can be a situation. As you can see, though, because it's still pinched, it's going to try to hold it down. That doesn't mean it's safe to take your hand off this. I would recommend always keeping sure that somebody is there for safety reasons. Now we can lift the patient's legs. If it's a heavier patient, obviously you can have 2 people help lift the legs. And then while you're doing that, you can get both of them undone. And now the patient is safely out of the Hoyer lift. We're going to unlock our wheels. Sometimes it's easier to do by hand. Sometimes it's easier to do by foot. You have a hold of the patient. If you would slowly, making sure we're not rolling over the sling, start to pull the patient out from underneath the lift. This is optional. We can pull the patient out. Now, if he was in a commode, I can just come straight back, which will demonstrate both. So this is if you need to remove with a wheelchair and you're in position to do it, you can take them away. And vice versa would be if you just pulled this away.